this is Carly. Welcome to Matters of Substance. On this episode today, we're going to discuss heroin and HIV. I want to go around the table and have everybody introduce themselves real quickly, just so you know who's sitting here, and then we will get started.
Hi, it's Caitlin.
Hi, this is Patty. Hi, this is Dawn.
All right.
I won't be resurfacing until later in the episode.
Once we get to the HIV portion, Dawn will join us again.
Yes, I will.
So we're going to go ahead and start off with recommending that you listen to our previous podcast. The title of that is The History of the United States Opioid Epidemic, where we discuss the history of opioids and what led us to where we're at today. But to get you caught up for today's session, we're going to go ahead and have Patty start off with giving us a little bit of the background to the opioid epidemic, and then we'll discuss heroin. Naturally, we'll probably evolve the conversation to heroin and then HIV as well.
Okay, so again, this is Patty. I just wanted to start off and give everybody a little bit of the history of opioids and where they come from. So opium was the first opioid, and it was derived from sap of opium poppies. So if you've ever heard of poppy seeds, people talk about that all the time. They'll be on like hamburger buns sometimes or bagels. It was derived from the sap of opium poppies. Their growth and cultivation dates date back to ancient civilization. So this has been around since, as far as we can see, from 3400 BC. And it was initially used by Egyptians and Persians. And then it spread throughout to Europe, India, China. Around the 18th century, physicians in the U.S. Started using opium as a therapeutic agent for multiple purposes. This could be relieving pain, from cancers, spasms. A lot of times they would use it for menstruation and childbirth. And towards the end of the 18th century, they started to recognize that there were addictive qualities to this. Mm-hmm. So in 1805, they isolated morphine and codeine from opium. And they were using the morphine as a cure for opium addiction. They thought the additive characteristics may work well, but as they learned more about it, they found out that it was 10 times more. They had 10 times more the euphoric effects than the equivalent of just the opium. So by separating it and using morphine as a way to try to stop addiction, they actually created a worse addiction. So where heroin comes into place is heroin itself was synthesized from morphine in 1874 by an English chemist. It wasn't produced commercially until 1898, and that was from Bayer, like Bayer Aspirin, Bayer Pharmaceutical Company. So the attempts were made to use heroin in place of morphine due to problems of morphine abuse. That you can take that back to the different wars and everything that we were going through. They would give soldiers morphine, try to help their pain or PTSD, things like that. Mm-hmm. Today, heroin in the United States comes mostly from Southeast Asia, Southwest Asia, Latin America, and Mexico. And then I could get into how it's sold, brown or white powder. There's lots of different nicknames for it, but that's kind of the basis of where it came from. It started out as just a natural product, and it's slowly been taken apart and analyzed and produced different ways now.
So what are all the different kinds of drugs that derive from that poppy seed? Do you know?
Well, I know of morphine, codeine. Obviously, when you when you alter it, what else can come from it?
Yeah.
So you have heroin, fentanyl, carfentanil, prescription pain pills. Mm-hmm. A lot of the any opioid prescription pain pill, anything with codeine, all that all is derived from that poppy seed, opium poppies.
And I think they make methadone with it too, correct?
I believe so.
So methadone is, for those of you who don't know, methadone is a medication that's used to help someone who has addiction to heroin or an opioid come down from that, or to regulate it medically rather, and then stop use is the goal.
Yes.
Okay. And I think we've heard a lot of things in the news lately about fentanyl, carfentanil being hugely high risk.
Yes.
I know that we present here at the Porter County Substance Abuse Council, we present Overdose Lifeline. And one of the things that we talk about, excuse me, in that presentation is fentanyl. And I think the stat that they give us is that it's like 50 to 100 times more potent. Yeah, fentanyl is 50 to 100 times more potent or stronger than morphine. So if you can imagine, that's a pretty high dosage. And I believe, at least I know in Porter County, we're seeing a increase of that being laced into some drugs. Not just heroin, but also marijuana. We've heard of that. So it's kind of a big issue, right?
Yes, it's a big issue. And then we're not seeing it really in Porter County that I know of, but then there is also carfentanil, which was originally an elephant tranquilizer, and it's even stronger than fentanyl. Mm-hmm. So when you get that mixed in with it, there's an even higher case of overdose, and it's even harder to reverse. If you have Narcan on you, it takes many, many, many doses. Mm-hmm. But yes, we're seeing it in a lot more than just opioids now and heroin.
Yeah. I know that when we're talking about heroin in particular, one of the things that we like to do is give a little bit of education for parents, for those who may be wondering if a family member is possibly under the influence of a certain drug. And so just to give you guys a little bit of information, heroin, if you're concerned that that might be something that a family member or a loved one is using, the signs that you want to look out for would be the person using would be seeming as if they have euphoria going on, drowsiness, impaired mental functions, slowed movement and breathing, needle marks, of course, and then boils. So sometimes when a person injects any kind of drug really into their body, they can get infections, and that will cause like a boil or something that you'll be visibly able to see on the skin surface. And then an overdose, you would be able to see that by shallow breathing, extremely small pupils, clammy skin, bluish-colored nails and lips, convulsions, or coma. So those are all things that might indicate that somebody has used and now is overdosing.
Yes, and there's something else that it could be a sign. Just like you said, all of those things. There's also like this noise that I've heard someone. It's like a gurgling noise that they're not. It doesn't sound like breathing, but it doesn't sound like it's just a very distinct noise. So that's something, if you're around somebody and that, and they have all of those symptoms or not, or they could also be making that noise, but it's a.
Can you recreate that noise for us, Caitlin?
It was like.
Is it like snoring or?
It almost,
like
but
gurgling?
Gurgling. It's very distinct.
Almost like an old dog.
But the mouth is closed, okay. And they're not. The breathing is not. It's not there.
Does it sound like congestion?
No.
Wait, how do you know this?
How do I know?
Like, have you heard this before? Or? Okay, gotcha.
Yeah.
Okay.
Yeah. So I witnessed it. Oh. Mm-hmm. And all of those things are very true. All of the color, the discoloration, the sounds, the clamminess, you can do whatever you're trying to do to get that person to wake up, and they're not.
Yeah.
So, but yeah, that noise.
So is that what they call a death rattle? Or
it kind of sounds like that. Exactly. Okay. Like you're just, I don't know what it is, like fluids that you're not able to swallow. You're not.
It's probably fluids in your lungs almost, or something stuck from swelling, or I don't know. But
well, vomiting can come from this too, right?
Yeah.
Do you think it's paired with the vomiting, or is it something separate?
I don't know. I don't know if it.
Okay, we're not doctors here. We've proven
right.
that time and time again.
Not doctors. So. All I know is that there was a noise, and what was causing it, I don't know. But be aware
So
of
it's
that
something
as
to look
well.
out for if you hear that. And
Yeah.
You're also seeing other signs and symptoms.
It sounds like it'll be distinct. It's not something you've commonly heard. It sounds like.
No.
Okay. That's good to know.
Something that I think people should know is also what it can be mixed with when you find heroin on the street. Most
When
of
you find it
well,
on the
when
street.
you get it on the
Okay.
street, when you purchase it off of the street,
Okay, just to
or when
clarify.
when your child or family or member or whoever is using has purchased it, it's not normally just heroin. It's normally mixed with other drugs or substances. Like we were talking, that's where you can find the fentanyl is in there. They might mix it with sugar, starches, powdered milk, baking soda, caffeine.
Was that when they're stepping on it, or is that when, like, when they're purchasing it off of a dealer that already stepped on it and adds things to the?
Yes.
Okay.
So the dealer adds things to make it to give you more, basically,
And so they can get some out of it.
To make the weight higher.
Yes.
Without the actual drug itself.
Yes. So it saves them money. They have a chance to make more money if they add these things to it.
And then they can take theirs out of there.
Yep. Yes. And they'll even add things. It's not just fentanyl. They'll add cocaine to it because that mixes right into, and cocaine is cheaper. So you
Wouldn't
also
that be a speedball? Isn't that what they call a speedball? I don't know if
when
they're
it's
going
got
to
the cocaine in it.
Yeah.
I could look it up, but I think
An
you're
8-ball
you're right.
or a speedball, yeah. Like when you're doing with the heroin and the
Right.
cocaine.
You get the ups, you get
I
the
believe,
downs.
you know what? But I believe that's what Jim Belushi
Yes, it is
was
true.
doing.
Mhm.
Yes.
And
I
possibly
like
River.
that about you. You know your culture, your hip culture.
History?
Although that happened about 25 years ago.
Yeah.
But I'm
But-
just saying you know stuff.
I don't know
Still
who died before River Phoenix or Jim Belushi, but I think it was the same thing when River was at the Viper Room in the
Yep.
bathroom using those two very powerful drugs
Mhm.
mixed together. Ugh.
Caitlin knows things.
Yes, she does.
Doesn't she?
I like
The
it.
counterculture and everything. That's good. I like that.
It's a good add-in.
It is.
Good to know.
From Skid Row.
Okay. So one of the things that we thought was interesting about, obviously, with heroin use, injecting is a very common form, a common way to use heroin, and so we wanted to kind of talk a little bit about what the consequences of using a drug through injection could be. And so that's going to lead us into a little bit more of this conversation about HIV. One of the things that I found to be very interesting that I read on avert.org, which is an agency that promotes health and talks about HIV and does a lot of education to that. They talk about how there is an estimated, let me kind of give you a little groundwork here. I'm talking about not necessarily a physical consequence here to using, but a social economic consequence. So they say that 56 to 90% of drug users will be imprisoned at some point in their life. So I like that stat. I think it's important to kind of bring that up because it shows that it's not just about the possibility of getting HIV. It's not just about the possibility of hepatitis C or many other illnesses that may come along with injection drug use, but you also have a consequence that may stem further with finances, legal things. A lot of people who get into recovery then have these challenges because they can't necessarily get a job that they want because they have these things on their record. So I found that to be kind of interesting. And I know that we're going to talk more about that physical HIV end of things, but I thought I'd like to share that before we move forward.
I'm glad you did.
Oh, thank you. So, Caitlin, I know you prepared a bit about the HIV portion of this conversation. So can you go ahead and just give us some information that you found? Or?
Sure. So some people know this and some people may not. But according to the AIDS Institute, this was information that I had to research for a project, along with other things, that scientists traced the virus back to chimpanzees in Africa. And it was something that was believed to be transmitted to humans after coming in contact with infected blood through hunting and then eating those chimpanzees. And then in 1959, a man in the Republic of Congo, that was the earliest known case. And then how it came to the U.S., I don't know. It made its way over here, right?
Yeah.
Yeah, just like every other virus.
Yeah.
So,
I guess it doesn't matter how.
No, doesn't matter how, but
It's
it got
here.
here.
Mm-hmm.
So, and then, there are a lot of common myths about how it can be spread, or that it's a gay disease, or people over 50 can't get it.
I've never heard that one.
that's a new one, yeah.
Don't sit on the toilet seat type of thing.
Mm-hmm.
But blood, semen, seminal fluid, and breast milk from a person HIV positive. Those are the different ways that it can be transmitted. And in fact, something I learned, because we had to go to the Aliveness Project as part of our research, which used to be in Gary, but I think they've relocated to Hammond. So at the Aliveness Project, they're kind of like case management for people who have been diagnosed with HIV. But anyway, the youngest client that they have at the Aliveness Project was 5 years old, having HIV, and the oldest person in their 80s. So I think he explained how the little child got infected with
It
it.
says it could pass through, if the mother's infected, it could pass through breast milk.
Yeah.
Wow.
And if she didn't know.
Right.
Mm-hmm.
So there's a little bit of...
Or just through pregnancy.
Pregnancy, right.
So what are the ways that they talk about that you can contract this?
Being bitten by an HIV patient and contact between open wounds.
Okay, well, the National Institute on Drug Abuse, it does say, like you just said, when people inject drugs and share needles or other drug equipment, that would be a primary cause, as well as when drugs impair the judgment of people, and then they in turn have unprotected sex with an infected partner.
Mm-hmm.
So that's the two main causes, and then all that other stuff that we mentioned. So it says, according to the CDC, 1 in 10 HIV diagnosis occurs among people who inject drugs. And in 2016, injection drug use contributed to nearly 20% of the recorded HIV cases among men, and 21% of HIV cases for females. And then again, it says what we were just talking about. Women who are infected can pass the virus through the umbilical cord to the baby. And so there you have it.
Well, I would think another way that you could get it, because you can get it through like open wounds and saliva, correct? I'm not wrong in saying. So when people are using drugs, a lot of times they have cracked lips. So if you're sharing anything that you're smoking, whether it was due to injecting or not, if you're all smoking off the same pipe, and you get some of their saliva in a cut on your lip, you could get HIV. It doesn't necessarily have to be like we talked about with the intravenous drugs. You could get it in lots of different ways. So you're not making the best decisions when you're doing these things.
So I'm sorry.
Oh, no, I was just going to say, to kind of highlight the topic there with drug use. It says here from avert.org again that people who inject drugs are 22 times more likely to acquire HIV than others in the population. So it puts you definitely at a higher risk, for sure.
Mm-hmm.
What about the less, the more innocent ways, like the more, what's the word? Ignorance.
Yeah.
Blood transfusions.
Yeah.
Yeah.
Don't they have a kind of a
Like a
process?
Yeah, now, but I think originally you're right. They didn't have the technology to actually screen it to that nth of a degree where
Can you
it was
imagine?
Yeah, could you imagine that? You go in just
You're
for,
sick, you get a blood transfusion, and then now you have HIV.
Mm-hmm.
Like, that's scary. It's amazing how much that we've gotten better with science and medicine and all the things we learn now that we can do these things. Because I'm sure there were probably quite a few people that got HIV from a blood transfusion or something they didn't even know about,
Mhm.
no risk. It wasn't anything that they'd done. We didn't know to do screenings like that.
Well, just like anything that's kind of new to us, right?
Right.
We don't really know how to appropriately address it
Right.
or the risk factors that are involved with that specific thing. So I imagine when HIV first became prevalent here, we just didn't know
Right.
what we needed to do to protect ourselves.
Well, look what's going on right now. The virus we have.
Yeah.
I mean, it's a pandemic. Everybody is running scared. Nobody knows what to do and how to treat it.
Mm-hmm.
It was kind of like that.
Yeah.
Back in the dark ages.
Yeah.
When I was hanging out. When I was alive. I don't even know if you guys were born back then, were you?
No.
Depends.
Let's not touch on that right now. But I was going to say drug use can worsen the progression of HIV and its symptoms, especially in the brain. Studies show that drugs can make it easier for HIV to enter the brain and cause greater nerve cell injury and problems with thinking, learning, and memory. You know what I mean? Like, I wouldn't necessarily would link those together. And I wouldn't even think it would be like a brain type disease or whatever. So that was interesting.
So if you're HIV positive and you're using drugs, I wonder, something I'll have to look up and maybe report on at a different podcast. But I wonder if it also can lead to it changing into the AIDS faster with the additional drug use. Because I know HIV is the precursor to AIDS, if I'm correct, right?
Yeah.
So you get HIV before it goes into full-blown AIDS.
Mhm.
So with it affecting your brain and things like that more, I wonder if it also pushes that transitioning into AIDS faster.
It's possible. Or don't you if you're not aware that you have HIV, it's very active in the beginning stages, but the symptoms may not be very noticeable. But getting sick with something else, I don't know if that progresses it along quicker to AIDS.
I don't know, but Patty, you don't have to do your research because I just found this. So
Nice.
It just said acquired immune deficiency syndrome, AIDS, is the final stage of an HIV infection when the body is unable to fend off the disease. A person with a healthy immune system has a T cell count between 500 and 1600. And it says here that this virus infects the body's immune cells called T cells, which are needed to fight the infection. So apparently it's the end stage of HIV if untreated.
Yeah.
And now they have treatments. I mean, I've even seen it on TV where they have treatments for people, which is great news because we've come a long way.
Yeah.
And actually, there was a website that I had looked up. So I hope I can find it. I might not be able to, but it might be on the avert.org, I'm guessing. Or I'm not quite sure, but there's a website you can go to. Actually, I think it was at the CDC, and it gives you the ability to look at different treatments in your area. And you put in like three questions. What's your gender? What is your sexual orientation? And if you are HIV positive or not. And then it gives you kind of like risks that you might be higher risk for depending on things that you answer. So it was a really cool site. I'll go ahead and find that and make sure I mention the actual site you can go to before the end of the podcast.
Mm-hmm.
Well, there's something called pre-exposure or PrEP, P-R-E-P. It's for HIV, and it's when people who are at significant risk for contracting HIV take a daily dose of this medication to prevent them from getting infection. And research has shown that PrEP has been an effective means in reducing the risk of HIV infection in people who do inject drugs.
That's awesome.
So that's good news right there. How to lessen the spread of viral infections. I do have a few words to say about that. Of course, we went over a few of them. Not using drugs. I mean, yes. Never sharing drug equipment. I don't know. Did we touch on that? Don't share needles. And the equipment that goes with it, and when you can get a free sterile needles and syringes, I don't know we don't do that here, but some communities do have like a needle exchange. We just have a needle disposal and collection. But if you could, you're just not supposed to use the same needle. I mean, that's what it boils down to, because otherwise you will promote possible HIV or other hepatitis or different kinds of diseases like that. So what else should you do? Get tested and treated for the viral infection. But I'm thinking if you're in the throes of using, injectables, you're not, I don't know how much you're really going to either pay attention to or care. I mean, maybe you would, but if you're so involved with the daily getting high and all the things that come with it, I'm not sure if you'd be paying attention to that. But if you do use drugs and you do use needles, then just all you have to do is really, I think, if you go to the Porter County or any health department, wouldn't they be the ones that you would? I mean, because don't they take people in just off the streets? Like, you don't necessarily have to. It's not like a real.
No, you can go in there and get tested for any sexually transmitted disease. HIV would be, of course, one of those. So they can go in there, and then they'll have resources available for you as well.
Okay.
Yeah.
So we all agree that the health department in any county, anywhere, would be the answer, just like for a test to see if you have anything.
Yeah, utilize your health departments more, because that's exactly what Connie Rudd, the director of nursing at our health department, said, that there are so many resources at our health department that people simply don't know about. People just don't think about it.
Right. And then when I go to the health department, there really isn't a lot of people there. No. So you can just go there, get treated, or take a test or do whatever, and you would be out in no time at all.
Yeah. Most people know that they offer the shots free if you don't have insurance, but there's so much more that they offer at the health departments. And I believe if you look at a health department website, it should come up with some of the different resources. It's worth, I think, anybody, anywhere going into their health department in this United States and talking to them about what services they offer, because there's so many. I'm sure we don't know all of them. There are tons of services that they offer, and it's all stuff that everybody needs.
Well, I was not familiar with anything that the health departments did. I mean, I was always told, don't go to the health department.
Really?
Well, because it just, I don't know. I'm not sure why, but I mean, now that I've worked here a while and I've got familiar with the health department and Connie and all this, they do, like Patty said, they have a ton of different things that they offer. And actually, they do, in case anybody wants to know, they do have Narcan.
Oh, yes.
Available. All you have to do is go in. Now, I'm not sure about other health departments, but the one in Porter County, Indiana, they do have Narcan. If you go in, all you have to do is take a little mini course, which is like 5 minutes, on how to use it, and then you just sign a paper and you're gone.
Can you tell us a little bit about Narcan, what that is used for?
Well, it's a reversal of the either opioids or heroin, and it's very easy to use. I mean, it's just like the ones that they have at the health department are just like one dose, little like nasal spray, and all you do is you just squirt it, 1 or 2 squirts in their nose. Hopefully, depending on the dose that the person has taken, it will reverse the effects of the opioids and snap them out immediately. And then, of course, you should call an EMT or whatever. But anyway, that's how long have we been doing that? At least 3 years, I believe. Yeah. So.
And there's no adverse effects if the person, if someone was administered that, and they weren't on an opioid.
That's a good point.
There's no negative effects.
Yeah. So.
And I think that's a fear a lot of people have. Like, I don't want to give somebody something and then not know if
then something worse is going to happen.
Exactly.
Right.
But like Dawn said, you should always, even if you have it on you and you use it and they wake up, you should always call 911, call the paramedics, get somebody there. Because sometimes it takes 8, 9, 10 doses to wake a person up. And you can also re-overdose if it wasn't enough. So it basically, imagine, a hat on someone's head and the wind blows and it blows it off. They put it back on their head. Well, the wind can still come and blow it off again. So until that's fully out of their system, you don't know that they're not going to re-overdose. So having somebody there, making sure somebody's called to take them into the hospital and make sure that they are okay and they're not going to re-overdose is always important.
When you talk about the hat on the head, you're talking about the receptors there, right?
Yes.
I was wondering about Patty's hat story.
There is a reason.
There's a really good visual. I can't do it.
No, that's a good. No, that was a
Podcast,
good
but
illustration.
It's a great visual.
Yeah.
And the hat would be the opioids on top of the receptor in
Yes.
the brain.
Mhm.
So the blowing off of the hat is like the Narcan or the
Blowing the
The wind
opioid
is
off.
Yeah, the
Which
wind is
makes them
Narcan.
wake up and
The
it
wind
makes
is
them
Narcan.
start to be able to breathe again because the brain and the breathing slows down, opioids slow you down. And then when you can knock that off, you can start to breathe, everything comes back to life.
Yeah.
But it's very easy for that to just, if you didn't have enough, reattach or sit back on top of the receptor.
Yeah, I think it's
So-
a great way to kind of get a visual, right? Because a lot
Right.
of times we're like, well, I don't really
Yeah.
know all the mechanics
Right.
of this. So I find that to be very
It's complex.
helpful. Yeah.
The whole brain science that we always talk
Mhm.
about is complex.
Absolutely.
So I found out something that was interesting.
Ooh.
Do you want to know?
Yes.
Sure.
Yes.
Okay, well, starting in October 2020, there is a plan for America. It's called Ending the HIV Epidemic. And the president outlined a 10-year initiative goal to reduce HIV injections to less than 3,000 per year by 2030. Infections, HIV infections, not injections. But so that's a huge undertaking.
Yeah.
Absolutely.
And then there's 4 pillars of ending the HIV epidemic is and they're common sense, just like a lot of things that we do. It's common sense, right?
Yeah.
Diagnose, treat, prevent, and respond. And then they have a map. Like there's a map of the United States. It's called the website is called hiv.gov/ending HIV epidemic.
Oh.
Yeah, so the HHS, the Human Health and Human Services, is proposing a once-in-a-generation opportunity to eliminate new HIV infections in our nation. And this initiative will work to accelerate progress and end the HIV epidemic by directing new funding to those communities affected by HIV in a phased approach, starting with the areas with the highest burden. So we live in Northwest Indiana, which is close to Cook County, Chicago, maybe 30 minutes away, pretty close. So, and then there's a lot of people also moving from Cook County and Chicago to Lakeport or LaPorte and all of
Our
Indiana.
different suburban areas.
What's that?
Our different suburban areas.
Yes.
Mhm.
So they're moving in, and with this high incident hotspots that'll show you if you look up on this map, 2 of them close to us is Illinois, Cook County, which, okay, there's people coming in that have this high incidence of HIV, as well as Marion County,
Mhm.
which is our state capital, which is not too far from us. So, like, we're really in an area that we might have higher incidence, of course, like they said, hotspots,
Yeah.
as opposed to other areas. So then I noticed that there's a designated health center. They're called Health Resource and Services Administrations. And oddly enough, we have one right here in Valparaiso, Indiana.
Oh.
Yes, I know.
Information I didn't
Does
know.
anybody know where it is?
No.
No.
Nope.
Okay, it's our friends at HealthLink.
Oh.
Oh, really?
Yes.
Good job, Helsinki. Yay.
Yeah,
cool.
shout out to HealthLink.
Yes.
HealthLink is
Great
on
job,
the
HealthLink.
Yeah, they're at 1001 Sturdy Road in Valparaiso. So that's a designated health center. So if you have any kind of HIV or an inkling that you may, that would be the place that you would definitely go, because then they will not only help treat it, they will report it, and then they help collect the data. And then also there's another one, a few in Portage. So if anybody's close to do you guys know where this is? The Stacy McKay Health and Education Center?
Is
Yeah.
that the one
high
inside the school?
I think so.
That's another one, I
Oh.
think. But there is, that might be inside the school. I'm not sure, but there is another additional.
Is it North Shore? Is that what I said?
Yeah, North Shore
That
also.
one's in the school.
North Shore, there's one in Portage and Chesterton.
Okay, so there's a North
Yes.
Shore inside of the school, so I'm wondering if that's the Stacy McKay one.
The
Maybe.
Stacy McKay looks like, I just searched it. That's the one that is inside the school. Then there's the other one across the street.
That's Portage
from the
High School
store.
for.
And yeah,
Really?
Portage High School. Inside the
Portage,
school.
oh,
doesn't
it's at
really
Portage
work.
High School?
Yes,
Yeah.
it's
Okay.
on the east side of the school. And they do a lot of, they have, they're there for teachers, they're there for students.
It's
A
really
lot
great
of times.
program.
Yes, it's an amazing program that they have it there so that teachers can be seen by doctors right at their.
Well, these
in school.
HRSA, these Health Resource and Service Administrations funded health centers, like we just said, the 2 in Portage,
Mhm.
1 in Chesterton and 1 in Valparaiso. They're funded centers. They are a key entry point for people with HIV who are undiagnosed. So we encourage
Okay.
people, if you have any symptoms, did we mention any of the symptoms?
No,
Or is
not
that
yet.
another
HIV.
show? I
Oh,
don't
that
know.
can be
We have
today.
not.
Is that a different show? I don't know, but if anybody, so it's inside of a school, so do they allow the students to go into these health centers? I mean, could they just go in there and?
Yeah, there's a separate entrance for outside, so they don't have to worry about the security issues. You can come up from the outside and it's all locked, but students can also go in.
Oh, okay. Well, that's good to know. So if anybody has any inkling that they have something going on, they should go to one of these centers. I'm not sure, does it cost money or?
I've never even heard of them, so I'm not quite
I'm
sure,
not
but that's
positive.
awesome.
Okay.
I know
Positive.
North Shore specifically is income based.
Mm-hmm.
Yes.
So I would assume that if they have services of any kind, they would go off of your income if you are unable to afford it.
Yes.
Okay.
I have also looked up some of the symptoms.
Patty has looked up the symptoms.
That
So, symptoms of AIDS can include, and it's kind of scary because sometimes you get, more of AIDS.
Once
AIDS or
again, you guys are
HIV.
not doctors.
This is AIDS. So, I should probably start with the HIV first because that's the first stage.
Yeah.
And those can be little things such as a headache, fatigue, aching muscles, sore throat,
We all
swollen
have that.
lymph nodes, a red rash that doesn't itch. It's usually on your torso, and
Shingles.
fever. So those are just some basic early signs and symptoms if you were having all that combined, or your throat's constantly sore, but you go to the doctor, you don't have strep throat, you don't have aching muscles, if they're hurting all the time, plus you have headaches and fatigue. Now, just because you have these, do not freak out and WebMD and run to your doctor and say, I have HIV.
WebMD, again, causes
I-
panic amongst
I get
everyone.
headaches pretty normally, and I do not have HIV. Just because you have a headache does not
Were you
mean have
tested?
HIV. Yes, I have been tested for HIV. Years and years ago, but yes, I have been. When you progress, say you have HIV, or say you didn't know you had it and you're starting to experience some of these are symptoms of that AIDS can include. There'd be rapid weight loss, reoccurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph node glands in your armpits, your groin, your neck, diarrhea lasting for more than a week, sores in your mouth, your anus, and your genitals, and pneumonia. So if you have HIV and you're experiencing some of those symptoms, you might want to look into, okay, this may be progressing into the full-blown AIDS, and look into what type of medicines or what you can do to try to stall it, or work through, knowing that it is at work starting to advance.
Well, I think it's important. I mean, those are all of the things that you mentioned, at least within the AIDS realm of things, those were all very significant things you would notice,
Yeah.
right?
Mhm.
Yeah.
Or they seemed like they were significant.
But the sad thing is, a lot of people wait until they have symptoms that are that bad, and at that point,
Yeah.
you've reached AIDS.
You know why?
Yeah.
Why?
Stigma?
No.
They don't have
no.
insurance.
Oh, there you go. They
Oh,
don't have
there it is.
insurance, but no, I'm not a doctor. But usually people that think they have something are the people that are not going to go because they're afraid to be diagnosed because they think they have something. Therefore, they wait until it gets so out of control that it is now something. So
Yeah.
Well, and
For
when
sure.
it gets that out of control, once it hits full-blown AIDS, when you're talking about the sores on the mouth, it becomes that much easier for them to give it to somebody else. If you've got open sores on your mouth, and again, take it back to drugs, even when you're sharing a pipe, or here, have some of my cigarette, because obviously they're not, or when you're kissing somebody, like, it just really expands how easy it is for them to transmit this
Mhm.
to somebody else and give it to somebody else once it's progressed that far.
right.
One of the things I read, I believe this was from the CDC, but I thought it was interesting that oftentimes people who inject drugs, they don't go to the doctor for the HIV symptoms very early on because one, they're not necessarily in a state to do so because they're in active addiction, and two, because of the stigma, and three, because of not having access to proper medical options. So I thought that was kind of interesting because they tend to go once it's progressed quite a bit. So it's not necessarily AIDS at that point, but it's pretty far into having the HIV infections and being pretty damaging already.
I've known people who have from the injection, and we were talking about something and we got onto it, but that they've waited so long that there is a huge infection in the area of injection. And
Right.
as we not all of us know about our neighbor Herb Stefferson, the same thing happened to him when he was injecting drugs into his foot, and he waited and waited, and he was experiencing a lot of pain and limping around, and
Is it like gangrene or what is it?
I don't know. He doesn't have any more blood flow to that toe, I don't think, though. Because it didn't have to be amputated, but it was very close.
And he shares his story in a book that he wrote. I've not had the pleasure of reading that yet, but I believe he does, correct?
Yeah.
Caitlin still has it. She's hoarding that book.
Oh, yes, I do. I've had it for like a year now. I remember because it was around this time that I was still newer to the office, and I got sick for the first time in years. And I was at home trying to fight this cold and reading this book as I'm like,
So one day we're going to hold Caitlin to actually giving us a book report and find out what's going on, right?
Yeah.
Yeah, it was very good.
It's all about the book.
Yeah.
Well, is there anything else that you guys find to be really helpful that we need to impart? Yes, Caitlin.
There is.
I really felt like a teacher in that moment.
You did, I saw you.
It was weird.
There is
good.
information, though. Now, this is from in 2016, but there are rates of persons living with HIV in Porter County, Lake County, LaPorte County, Marion County. Some don't have any reports at all because it's such a small number. So when the numbers are reported, anyway, so someone tell me if this makes sense to them. Okay, so Porter County in 2016, 101 of every 100,000 people were living with HIV.
That sounds like a lot.
That
Doesn't it?
sound like a lot.
Well, when you go into Lake County, 244 of every 100,000 people were living with HIV.
That's a lot of people to have a
Is it?
disease.
I wonder if they're older.
Portage has 30-something thousand people. So
Where do you get that information from?
This is from aidsvu.org.
Oh.
Oh. Well, I wonder, does it say an age group?
Let's see.
I'm just asking because we were talking earlier
Yes.
about age. Okay, what do you got?
It does say that. Well, is this in Porter County? This is in Indiana.
Okay.
Okay. Aged 31.4% aged 45 to 54 years old.
There you go. We were just talking about that.
That's the highest percentage right there.
And when you look up the population of Porter County, just to make this, it said for every 100,000 people, there's 101 estimated to have AIDS.
Mhm.
Porter County's population is 168,404.
Mhm.
So we're looking at, estimately, we probably have about 120 people in our county.
Wow.
That seems like a lot.
It seems
doesn't it?
like kind of a lot.
For one disease, yeah. I mean, if we were to look for one blood disease that's affecting, that can affect you so harshly and have so many bad side effects. And yes, we're getting close to a cure, and we have plans for that. But for the 120 people in Porter County to have AIDS, that just, it doesn't
Not
feel
AIDS,
like
though.
HIV.
Okay, right.
That seems like an extremely high
But
number.
look at, like, you just said it was between 45 and 54, the age group.
Mhm.
We were talking earlier, like the boomer generation in the 80s, we didn't take that
Seriously?
target population, didn't take many precautions about that, because it was more like we were talking about free love and all this stuff, and people really weren't as cautious, because up till that time, like, what did we have, syphilis and a few different random things or whatever.
I don't think they realized they needed to be.
Right, and then also the not only HIV but the hepatitis. Like, there's a large amount of people in that age group that have hepatitis, and they're just walking around with it because of all the same reasons. So that would make sense with that age group.
Yeah. And keep in mind, this is data from 2016. That's like 4 years ago. So it could have increased.
Right.
Well, I think too, kind of partnering my thought process here with what you were just saying about the age group. We also have to think about when did HIV and AIDS become very, very, like, when did the spotlight come into, into our country?
80s.
Exactly. So in the 70s.
Oh, right. In the
Yeah.
70s, there was a lot of
Spotlighted.
risky behaviors.
Yeah.
People weren't realizing there was a problem.
Right. And
Yeah.
but by the time it manifested or whatever, probably in people's bodies and spread. I mean, I do remember that it was a huge panic.
Sure, yeah.
You know what I mean? Everybody, and then people were literally dying. It would go right pretty much into AIDS.
Wow.
And so I don't know.
So if we don't have knowledge about something, we can't really prevent it
Right.
or know to.
Knowledge is power.
Knowledge is power.
It is.
It actually says in 1981, the Centers for Disease Control and Prevention published a report about 5 previously healthy homosexual men becoming infected with pneumococcal pneumonia. I probably said that wrong.
Connie Rudd would be appalled.
Pneumocystis pneumonia, and I guess it was caused by the normally harmless fungus pneumocystis. pneumocystis. I'm sure I'm saying it wrong.
We are too.
So this fungus is typically harmless, but when these 5 men were having issues with this and it was making them very sick, that's how they began to find out that there's something wrong and figure out that it was what we now call AIDS.
Yeah. Well, I think we've kind of given a lot for the listeners to digest in this episode.
I hope it wasn't too much.
Yeah.
Was it?
Nah.
No, they can handle it. Our listeners are troopers.
Oh, yeah.
You can follow us on. We know you're with us.
What are we going to do next time?
Well, I am thinking, hopefully for next week's episode, we will have one of the representatives from the coroner's office.
Ooh, I hope it's Christy.
Yeah, that'd be awesome.
Mm-hmm.
She's
Patty, why don't you try to pronounce her last name? You're good with pronunciation.
I am not good with
I know how to say her last name.
Okay, Caitlin, what do you got?
Her name is Christy Shervanek.
Nice.
Nice pronunciation. I do like it. Mm-hmm.
Mm-hmm.
Yes.
So we will be having her on our next episode. We're hoping to have her on our next episode to kind of further the conversation about what's going on specifically in Porter County in terms of what we're seeing in our overdoses. And we believe that there's probably a pretty good number that would connect to that whole heroin and opioid epidemic. So we'll be discussing that. And
I want to at some point discuss. I want to delve into hepatitis.
sure.
Definitely.
Mhm. I mean,
That could be an entire episode.
Yeah. I need to talk about that.
Let us know in your comments. Tell us if you want to hear about hepatitis.
Where would the comments be?
Facebook, Twitter. Well, Twitter would be a retweet, right?
Yes.
I don't know. Caitlin's trying to mouth us some. What are you saying over there?
YouTube? Are we on YouTube?
Oh, YouTube?
Oh, we are not on YouTube
Okay.
yet, guys.
Wah,
Unfortunately,
wah.
we do not have our video capacity.
But you know
yet,
what we
but-
do have? We do have WVLP
Yes, we do.
Yes.
103.1 community radio in Valparaiso, and it is live streaming on Tuesdays at 10 a.m.
Mm-hmm.
Yes.
So we replay our stuff there too.
Yeah.
Yeah.
Mhm.
And please check them out. Support them. They have a lot of great shows.
They do. Matters of Substance is great. They do have some other. I do like. What's that one they have with the two dads?
The two dads.
I think
it's
it's Two
called
Dads.
Two
Two
Dads.
dads that rock or something to that effect.
Rock
but
and
they're-
roll with dads.
Yeah, they're good. I
They're
like
pretty
them.
good.
And then they do have a heavy metal host that is also a professor at VU.
Oh,
So if we have anybody that's
I
going
like
to
that
be,
one.
yeah, he's good. I met him on the way out one day.
Oh.
Good show. So
So
that's what we have.
WVLP.org.
Yeah,
Check it out there.
yeah, excellent. Okay.
All right. Well, thank
Okay.
you for joining us, everyone.
Thanks for joining us.
Thank you. Enjoy the show.
See you next time.
I hope we see you next week.